Welcome to Health Systems CIO's Partner Perspective Interview Series. I'm Anthony Guerra, founder and editor-in-chief. Today we're talking with Gus Malezis, president and CEO at Imprivata, about how health systems are navigating their COVID vaccine rollouts, why identity is a key to any digital transformation strategy, and how he's working to ensure Imprivata can meet its customers' future needs. Gus, thanks for joining me today.
Anthony, a pleasure to be here.
All right, Gus, a little bit about your organization and your role over there.
Imprivata has been in the business of providing digital identity for healthcare now for coming up on 20 years. We're very proud of the work that we do. And frankly, we look at our customers as being the providers, the doctors, the nurses, and how do we give them something that's efficient so that we can help in their IT access. But we also look at CIOs and CISOs and compliance officers as part of our customer base. So how do we give that technology in a secure manner and a compliant manner? So we try to balance those three things. And I think over the years, we've learned how to do that pretty well with digital identity. We've spoken a little bit about digital identity in the past, but it is what defines who you are and what are you entitled to. And on that basis, technology can give you the keys to the kingdom, the ones that you sort of should have, and give you fast, easy access and do that securely and with compliance. And our customers are very delighted with this technology and what it allows them to accomplish.
And you're the CEO, which we know. How do you think about the CEO role and your job and what you're supposed to be doing?
Well, I really am the chief cook and bottle washer, and I do the dishes as well. And actually reminds me of the very first job I had during college. Well, actually, I did work as a dishwasher, but it's a great job because it means I have the opportunity and the privilege to work with some terrific people, but also dive into every aspect of the business, all the way from talking to customers, which is really where I get a lot of wonderful information and a lot of clarity on what we need to do for them. We then talk to our sales and marketing people to make sure that we are focusing our efforts properly for the benefit of our customers. And then, of course, work with our products people. Mm-hmm. And that now really gets really exciting and innovative because that gives us kind of the closed loop. And frankly, there's one more element to the business that I find very important, which is how do we guide our customers to success, which is all about post-sales, all about implementation and value delivery. So those are really kind of where I spend, those are the four areas where I spend my time throughout the day. And it varies depending what's going on in our market, what's going on with our customers, and maybe what's going on with our business. But those are the four priorities in my professional life.
I don't know if you caught this, but maybe 3 weeks ago, so there was a clip going around. Elon Musk was talking about CEOs and what he saw out there, and he said he thinks CEOs need to spend more time focusing on making amazing products and services and less time in the boardroom and with spreadsheets. What do you think about that?
I think he's right. It's hard to argue with that. That is a part of every CEO's job to spend time with the board, but often that consumes a ton of time. Mm-hmm. And sometimes CEOs get very comfortable in doing just that. They get really good at it. They get very comfortable. The problem is the business is all about the customer, mm-hmm. and the business is all about value to the customer. And that value is always a moving target. It's value today is might yield success today, but that value tomorrow is going to be different. Maybe not entirely different. You could always build on your value of yesterday, but you're pretty much guaranteed that from yesterday to today to tomorrow, that value has to elevate, right? And it will change. So I think cracking the code is something that many CEOs say, wait, we cracked the code. Well, okay, now the code's just changed. Crack it.
So that's so true. And I think that is probably the CEO's number one job, is to understand when things are changing to when we have to do things differently because our customer needs are evolving. That's your job. Nobody else is going to do that.
Yeah, that's exactly right. And you could do it a couple ways. You could listen very carefully to customers, and there are
Mhm.
customers that are always, very innovative and have great ideas. And some of them are way ahead of the market, but some are just ahead enough. So you gotta, and some are, maybe just treading water. There is a whole spectrum. So you gotta listen to all of that and then discern what it is that's really needed in the near future, the medium and long-term future. I do have a challenge with CEOs that believe they know everything,
Mhm.
and or CTOs that believe they know everything and they know the future, and then customers will just adopt it. I do not, I don't connect to that philosophy. I think you always want to connect with customers because they got specific needs, and you should solve them.
Yep, yep. Well, I could ask you a billion questions about leadership and all that stuff, but let's talk about what your customers are dealing with right now. And we know that one of the biggest things they're dealing with is the vaccine rollout. So getting shots in arms and helping their organization facilitate that with technology. What are you hearing from your customers about how they're grappling with that as it impacts some of the things that they use you for?
Yeah, yeah, great question. In fact, it proves the point of this discussion, this prior point we just made. No one predicted COVID. No one expected it to show up, and here it is. And now you gotta, adjust and pivot and shift to make sure that, even though no one saw it coming, what is it that your customers need? So customers, of course, now do need to get vaccines in people's arms. They need to do it not just in small scale, which we've seen start a number of months back, but now they got to do it in large scale, and they got to do it efficiently and safely. And they have to record all of this, and it's got to be done with compliance. And a lot of these systems, frankly, were never really designed to do that. There's talk about this digital, vaccine passport, right?
Hmm.
Some form of it that countries around the world, for example, have been talking about. Well, what is that? Well, it doesn't really exist. No one thought of this, but there are systems that are in place that can help. But back to our customers, I do want to make a point that there's still an overhang. There still is an aftermath of 2020. A lot of our customers had massive disruptions to their operations, to their workforce, to their financial systems as well. And I think it's important that we recognize all of that. Now, even though we have vaccines rolling out, that doesn't mean that we are out of the woods yet, that our customers are out of the woods yet. They still got to solve the problem of the past and dig themselves out of, some challenges, including financial challenges. So yes, right now vaccines are going out. They're still trying to figure out how to balance their books. But above all, is getting these vaccines out efficiently to the right people. And how do you get the right people? Who do you know who got the first dose and which version? Which vaccine of dose number one did they get? Was it the Moderna? Was it the, now they're going to get the second dose, right? Is the timing right? Are they going to get the right second dose of what they had before? So it could be pretty, complex in front of our customers, and they're shifting through all of that. They're trying to sort through all of that now.
Yeah, and there's a lot of identity issues there, right? I mean, vaccine distribution. You could be because you're vaccinating people that may not have been previously involved with your health system, and that may be a point of introduction to your health system. You want to perhaps capture that potential quote unquote customer digitally. You're creating a new identity for them, thousands and tens of thousands of new accounts, proof of vaccination, this digital wallet we're talking about, and then overall digital transformation. Um, every health system is working on that, trying to minimize paper, minimize in person interactions. So, thousands and thousands and thousands of digital identities. We know there have been issues around patient matching, making sure you have the right patient. Where are the things that you're doing come in to help?
Yeah, it's you're talking. You're right. Digital identity comes to the forefront all of a sudden. In fact, just a few days ago, NIST and CISA. This is NIST, and I think the National Institute of Standards and Technologies, and CISA, Cybersecurity Infrastructure Security Agency, sent out a note, and this was mostly around, frankly, the SolarWinds, but also the Microsoft hacks that we've seen recently. But they said something very material to this topic, is that digital identity is crucial. If we had trusted digital identities, these events would have been better controlled, better identified. They might have even not have happened the same level. So it's a really interesting article. It came out March 4th by Jay Gasley, and it's really worth reading. And they essentially call out what many of the leading thought vendors, digital identity vendors, including Imprivata, has been calling out. In the digital world, we don't know who's who. We don't have that driver's license, that trusted document that entitles you, right? That you've been tested, you've been certified, now it's a privilege, you're entitled to drive a vehicle on the road. We can drive on the digital highways with no identity, and that's the problem. So how does this impact the patient side as they're about to go get a vaccine? Well, they are an unknown, right? If you have some pre-existing conditions, you show up at a different institution that may be a little closer, maybe it's a pharmacy. You don't know if you're going to have a reaction. They don't know if you're the right person. They're giving you a jab, and you hope for the best.
Mm-hmm.
So they're doing it in the blind, and frankly, it's kind of hard to blame them. That's the best they can do right now, but I think we can do better as a country, as a technology coalition of vendors. We can do better. What we've done at Imprivata is we've enabled our partners with highly trusted digital identity for patients using your palm. So you show up, you put your palm down, your record comes up, not that of your twin, but your record comes up, so they know who you are. They completely trust that, and they can look up, hey, is this the right thing for you? Is this the right dose? Is this the right vaccine, the right brand? And then give you that jab. And that's the way it should be happening if you talk to the scientific community. So that's how we support. That's why we support this vaccine distribution process. I'd like to say that everybody's using that process, but in reality, we're not quite there yet.
So it seems to be. I mean, the NIST article, I saw it, the one that you mentioned. They're pretty much saying it's identity. Identity is the way to go. Do you think that's a general consensus out there, that is an element of good security, or the element? I mean, there are it's a larger picture. Is it one element of a larger picture of good security?
It is one element, but I would characterize it as a hypercritical element of not just security, but compliance and productivity. I actually look at it as, element is one way, but I think I prefer to look at it as a fabric. It is the fabric that connects, that identifies us to the environment, giving us good, fast, secure access, ensuring that we don't break cybersecurity controls and don't let the bad guys in.
Mm-hmm.
Come in and do things, on our behalf, masquerading as Gus Malezis. And it's also something that absolutely addresses compliance. So digital identity has been viewed in the past in a very narrow manner, also has been viewed as a concern of privacy, right? In our country here, where privacy is very, very, much respected and a topic of discussion and concern. Digital identity has kind of taken a bit of a backseat. And what NIST is saying, we completely subscribe to. You need to put that capability in motion, because it's going to help your productivity, it'll help your cybersecurity, and it will help your compliance and privacy.
Do you see organizations out there struggling to deal with a fragmented market? Are there components, and many organizations have tried to piece this together?
That's a great point. That's a really great point, Anthony. The digital identity technology, the vendor space is highly fragmented. There are very few solution vendors in digital identity. In fact, most of them are individual component vendors. And in fact, when I look at that world, there's hundreds of these vendors. So if you're a customer, if you're a major IDN, or even the small hospital around the corner in small town America, you're confronted with a puzzle that is very challenging. It's like you're going to run to your local hardware store, pick up a bunch of pieces, and build out a rocket ship. Right? The kind of level of complexity you're dealing with. So frankly, I think the industry has done a disservice. The vendor industry has done a disservice to the customer base. But Imprivata sees that as the opportunity. And our strategy has been to build best of class components, but integrate them into a solution so that the customer can plug and play and get up and running very quickly. And we've had a great deal of success with that.
So you did a acquisition late last year, a company called Fair Warning. Was that an effort to provide that, end-to-end solution? You take a piece outside of what you were offering, said, we want to offer a full suite, so we need to plug this in.
Precisely. That's precisely right. And in fact, I'll paint a little bit of a picture here. Just as much as you got a lot of fragmentation in the vendor community, there is no really good guidance of what a digital identity strategy should look like for customers. If you are, again, an IDN or a small hospital in small town America, how do you know what that is? Imprivata took the step of building a digital identity framework, an architecture, right, that you can look at with a bunch of columns and boxes. And we released that to the market about a year ago to great reaction. It's not about products, it's about all the pieces you need and how they need to work together. So now customers have a view of what they need. So in that, digital identity framework, and by the way, if you want a copy of that, just jump to the website, imprivata.com. You'll see it, the diff. It's easy to pull it down. Feel free to, to use that. But the point about that is to provide an architecture for a digital identity infrastructure, that fabric that connects productivity to cybersecurity and compliance. And frankly, we haven't seen that from any other vendor. So we think that the industry is behind, but there's some goodness there in what's available so far. We have a set of solutions that were lacking reporting and privacy analytics. So if you look at that diff as an example, and we're happy to kind of share, the visual graphic, you have a set of columns. One of the things that was missing was reporting and analysis on privacy events for patients. And we wanted to close that gap. So that was part of the Fair Warning acquisition. For those who are more technical, let me sort of describe that a little differently. Our customers use our badge snap, one sign, which is a single sign-on, and they badge snap into a system. And that's the keys to the kingdom, right? That's the front door lock and key system to the kingdom. Well, before you can give people keys, we also believe that you should know who you're giving it to. You should know who you're giving it to, why you're giving it to them, and what exactly they should be able to do with it. And that's called identity governance. Mm-hmm. So, you're now seeing two pillars here appear. You've got the digital identity access system, which is one sign. You've got the identity governance, which tells you what you should be able to do. But once you've got these two things, then you got to circle back and say, okay, is this user doing the right stuff? All right, we're giving them the keys to the kingdom. We think we're giving them the right stuff, but are they doing the right things? That's what Fair Warning allows us to do. Allows us to dive deep into all those user actions to make sure that we truly understand what they're now doing with those keys and identify any issues.
Were you hearing from your customers something to the effect of, hey, it would be great if you were able to provide this piece, the reporting and the other issues that you mentioned, and you hear something like that enough and you go, maybe we should think about it?
We did, as a matter of fact. We always have ideas, and quite often they come from customers. Quite often, they come from maybe some of our technical innovators. But we always validate with customers one way or another. And we've known Fair Warning for many, many, many years. We love the technology. We love what they did with customers. We love the business, frankly, and the people. And after, sort of every year we get together at Chime or HIMSS and we say, hey, we should do something together. And customers are always supportive of that. So when we did it, when we made the acquisition, we reached out to customers that were joined and say, here's why we did it. They were all ecstatic. Well, collapsing the stack, fewer vendors for customers to deal with, integration out of the box, interoperability out of the box. And customers were pleased that not only can they get better purchasing power here, but they get systems that are interoperable, work better together. And when something breaks, they have one vendor to go to ensure rapid return to functionality.
Yeah, we've seen in healthcare IT before, acquisitions, mergers, where the hopes for underlying integration, it didn't happen, never happened. I can think of companies in the past. How do you make sure that doesn't happen? Do you just say, hey guys, get to work? This is what we want to do. Now we got to do it, because the day you acquire the company, that work's not done. That work's got to be done, right?
Yeah, that's right. I mean, there's many, many acquisitions. And frankly, there's a lot of companies in the technology space where they're well known. They have an infamously, where good companies go off to pass.
Right.
I think die is a more dire word here, but yes. Well, we're not that company. We really do have a strategy of that integration, and we make sure we bring things in, just not to run them as a portfolio company, but to truly add the 1 + 1 = 4. With Fair Warning, just to tell you another, kind of give you some more visibility on our interest is, Fair Warning collects information about what's happening relative to patient access, patient information. And so they collect a lot of data, right? So Fair Warning and all that class of technology, Fair Warning and its competitors, if you will, collect hordes and hordes of data, lots of data. And that data is doubling every few years. And the very first thing that they got to do in order to make sense of this data, right? Once they collect this data, the very first thing they got to do is ask the question, who is doing these actions? Who is the who? Who is the actor? And trying to answer that question is a very complex task, the way the industry has been doing it. Well, Imprivata solves this immediately, because we have one sign, we have digital identity for the provider. We also have patient secure, which is digital identity for the patient. We can immediately and definitively, without any argument, answer the question of who is the provider, who is the patient. So, things like artificial intelligence and other heavy forms of computing that was thrown at this bulk of data to answer the question of who gets answered immediately with good, clean data. That's beyond question. The last question that gets asked is also a material question here that, again, all of these companies struggle with, including Fair Warning, by the way, which is that once you've answered the who and you look and see what this individual is doing, then you want to say, okay, this is strange, but is that part of their profile? Should they actually be doing these things? And how do you answer that? This is fuzzy logic stuff. The way we like to answer it is with definitive data that says, Dr. Gus is entitled to do these things and entitled to look at these patients. And we have that technology with identity governance. So again, this is the reason that the Fair Warning acquisition made sense, both from an integration perspective, but also the fact that we can map data in that answers two critical questions that they really couldn't answer particularly well. The whole industry can't. So yeah, that's why customers see this as a 1 + 1 = really 4, maybe even 5. Very high value output.
An acquisition like this, any move like this as a business, does it make sense to say we're always working as a business, you're always working to make yourself more unique as a value proposition, right? So you look out and you say, how can we further differentiate ourselves from our competitors? Everyone says they have no competitors. but we want that to be true as a business, right? So how do we become our own entity at a good value to people who need us? I would imagine again that's also part of this. It's part of continuing that separation. Does that
Yeah.
make sense?
It absolutely does. How do we become better than our competitors?
Right.
I actually prefer to say, let's keep an eye on competitors, but our ears and our eyes should all be on the customer. If we can be a better partner to the customer, then by definition, we've done something better than our competitors have. So, we prefer to, focus on the customer versus the competitor versus the differentiation. Not to say that we don't have those discussions, but what always comes on top is how do we be a better partner to our customers? How do we build that loyalty and the value delivery? And if we do that, then we're probably in a stronger relationship than anybody else.
Well, I got one for you here. So what about what I'll call the Steve Jobs issue? And by that I mean, if you listen to your customers, you're going to be limited by their vision. Steve Jobs, he built the iPhone. He built something that people didn't even know they wanted or needed. And I tell anybody who asks me, I said, that's one in a million. You can't run a business like Steve Jobs. That's one off. Otherwise, you have to do what you're saying, which is keep an eye on your competitors. And I always do. Listen to your customers. But there's that Steve Jobs thing that says there's something beyond even that.
Yeah, yeah, yeah. I look. It's kind of hard to argue. I mean, there's Elon Musk. You mentioned Elon Musk earlier, where he wants to go to Mars and take people to Mars. The people want to go to Mars, right? There's nothing green there. There's no water. There's no flowing. There's no atmosphere to speak of. But Elon wants to go to Mars, right? And is something going to stop Elon from going to Mars? I don't know. Maybe, maybe not. I actually think personally he's going to make it. The question is, do we all want to go to Mars, right? Do
Right.
we want to follow Steve Jobs? I do think that you can never go wrong listening to your customers. And you should have a vision for the future, right? Sometimes customers need things today, need things to solve practical problems that they're facing today, and you got to take that in. And there are customers that are always looking more forward, and I think it's important to listen to all these groups of customers and then chart that path forward. I think to say that we know better than customers is a little brash,
Mm-hmm.
more than a little brash. And that's not our philosophy. Healthcare has brilliant people. And we're just delighted working with them, and we get a great deal in that relationship.
Yeah, it's that listening to multiple customers, and then what I would say is it's where what are the patterns? Where am I hearing things from multiple people? Oh, that sounds like something they said over there, and now I'm hearing it again over here. All right, now we got something, right? It's some of that.
Well, cloud is an example of that. If I were to turn the clock back, say 2 years ago, the industry in many areas outside of healthcare was adopting more cloud services. And healthcare was a little more concerned about safety, about privacy, about disconnect from the internet, right? There could be some sort of an
Hmm.
event that a hurricane, a weather condition, or backhoe cutting off the internet. And there is that, hey, if I lose the internet, how do I access patient records if that's where they are on the other side of that connection? They're very, very accurate about it, right? It's not as if they can tell the patient, hey, just come back in 2 weeks, pause for a second, right? So healthcare has some very unique, considerations. And we always design solutions knowing that if our stuff doesn't work, patients fall out of bed. And if we design with that in mind, then we'll design it the right way, where that never happens. If we forget and ignore that reality, then we'll have a problem. But cloud is being adopted more and more. And in fact, we ourselves are moving faster into the cloud because we can deliver more solutions to the customer faster without waiting for them to do upgrades on their own. We can do it for them as the experts. And we're working very closely with all the EHR EMR vendors so that is a well-coordinated transition.
Before a couple of more quick questions, and then I want to let you go. What's your favorite method for hearing from customers, you personally?
Well, I reach out to them. I reach out to them in a variety of ways, one-on-one. They all have my cell phone number, and they know that, first of all, if there's an issue, if there's a problem, or if they think we can do something better, I'd love nothing better than on a Saturday night, watching football, it doesn't matter what it is, to get a phone call.
Hmm.
If it's something that's troubling the customer, I want them to call me because the chances are I can actually do something about it. Right. And I don't care what time of the day it is. I know they work 24/7. So that's my job, and I enjoy it. But we have more structured ways, right? I reach customers on a one-on-one basis. We reach them when we did that fair warning acquisition. We swept through about, all of their customers and ours. We also do executive customer councils, where we get together and we talk about the here, the now, as well as the future. But pretty much any which way a customer wants to reach me. My email is easy. It's Gus, Gus, Imprivata,
Yeah.
and I'm the only Gus at Imprivata, so you're guaranteed it will come to me. And I'd love to hear from them.
Yeah, well, I think it's definitely key to success. Last question before I let you go. The tea leaves, the future. What are you thinking? I mean, I know you're not going to tell me about the next acquisition. Maybe there is one, maybe there isn't. But as we said, the CEO's job, your job, you're listening to the customers. You have to be ready in 2 years. You can't start in 2 years. You have to start now. So you have to figure out where are things going and say, hey, we need to start looking into this, investigating this, developing this, start checking out the market. I want to pick this up. I want this piece in our offering. We're missing this. So whatever you can give me that might be of interest to your customers about what you're thinking.
Yeah, and I'll answer that in two ways. One, how does the vision and the strategy, progress into the future? And I know our senior leaders at our customer base always care about, hey, what's your vision? What's your strategy? Where are you going with this?
Hmm.
And then what are some of the sort of, maybe more near term, more, interesting, unique, tactical things? First of all, on vision and strategy, it is about digital identity, and leveraging digital identity as that binding fabric
Hmm.
for productivity and reducing burnout with providers, ensuring that we have good cybersecurity. And God knows we need it with everything that's going on right now. And that shows it doesn't show to be abating in any way. And then, of course, compliance, because we know we got the compliance responsibility. So, our vision is always going to be very centered around digital identity and patient privacy. Now, major investments are in areas around this. By the way, that's the DIF, the Digital Identity Framework. So, I think if you just look at that, you'll see where we need to strengthen things. So maybe, privilege access management is one area that you'll see us act on, but advanced biometrics, facial recognition, this is still an area where there's a lot of debate about privacy. But there are some customers that want to use it in very set, specific ways, where they thought it through and they said, on this basis, I want to be able to give a better experience, and I want to see someone walking in. I want to guide them, and I want to use facial recognition, or maybe a palm, or a combination of things. So biometrics is a big area for us. Analytics, data analytics is another big area for us. We generate a lot of data. Our customers generate a lot of data, and there's a wealth of conclusions that could be derived out of that data. And Imprivata has not really had a thorough reporting and analytics product. With fair warning, now we do. So we're going to continue to build that up, and we have a ways to go. So defragmenting, the digital identity space, there's still a lot of fragmented things that you got to go do, investing more in cloud. So these are really the themes that we're investing in, none of which compromise that easy, invisible nature of our technology, right? That iconic, invisible badge tap or fingerprint that will always continue to work. And by the way, a couple of other areas, there's mobility and medical devices.
Medical devices are big. We hear lots and lots about that.
Yes, medical devices is big, and the FDA started to spend more energy and time and attention on securing those devices because they're not these devices are still legacy.
Yeah.
They're now connecting more and more. But mobility, everybody wants to be more efficient. They want to use, the smartphone or a tablet, just like all of us, everywhere else. And they want to be, and it can be more productive, more functional with these.
All right, Gus, that was a wonderful chat. It's always fun to speak to you. It sounds like you're having fun, and I'm glad to see that's continuing. And it's been great.
It's a pleasure. We have the privilege of working with an incredible group of professionals. This is in our customers, and we are just so blessed to see them doing what they're doing for their communities, especially in this pandemic. And that really empowers us to do, every little bit and go above and beyond in helping them. So it never feels like hard work. I mean, yes, it is, but we're delighted to be doing it.
All right. Well, thank you, and I hope you don't get too many calls on a Saturday night, but you brought it on yourself. So.
I don't want.
All right, Gus. Thank you. You have a great day.
Thanks, Anthony.